How does an endoscopy detect Barrett's esophagus? Imagine peering inside your own body to see what's happening in your esophagus. That's exactly what an endoscopy allows doctors to do. It's a simple but powerful tool used to find out if you have Barrett's esophagus. During the procedure, a doctor gently inserts a flexible tube called an endoscope through your mouth and down your throat. This tube has a tiny camera attached to its end, which sends real-time images to a monitor. You might be given medication to help you relax so the procedure is comfortable. The whole process usually takes about 15 to 20 minutes. As the camera moves through your esophagus, the doctor looks carefully at the lining. Normally, the esophagus has a pale pink, smooth surface. But if you have Barrett's esophagus, the lining may look different, often a salmon color and with a rougher texture. Sometimes, acid reflux can cause inflammation that makes it harder to see these changes clearly. To confirm whether you have Barrett's esophagus, the doctor takes small tissue samples called biopsies from different areas of the esophagus. These tiny samples are collected with special tools passed through the endoscope. The biopsies are then sent to a lab for analysis. Under the microscope, normal esophageal tissue shows flat, layered cells called stratified squamous epithelium. In Barrett's esophagus, these cells are replaced by taller, rectangular cells called columnar epithelium, which are typical of intestinal tissue. Finding these cells in the esophagus confirms the diagnosis. Endoscopy is the best way to detect Barrett's esophagus because it allows direct visualization of the tissue and the ability to take biopsies. For people with ongoing acid reflux or gastroesophageal reflux disease, regular endoscopies help catch any early changes before they become more serious. If Barrett's esophagus is diagnosed, doctors often recommend more frequent endoscopies to monitor for further changes. Managing acid reflux with lifestyle adjustments and medications can help protect the esophagus and reduce the risk of developing complications. In summary, an endoscopy detects Barrett's esophagus by allowing doctors to see the lining directly and take tissue samples for confirmation. This procedure is especially important for those with long-term acid reflux symptoms, as early detection can make a big difference in treatment and outcomes.